For Labrador retrievers, one of the most common causes of mortality is cancer. Several types are prevalent in the breed. Lymphoma, a cancer of the lymphatic system, is frequently diagnosed. It often appears as swollen lymph nodes around the neck, shoulders, or behind the knees. Hemangiosarcoma is another aggressive cancer that affects blood vessel lining, commonly found in the spleen, heart, or liver. Mast cell tumors, which are a type of skin cancer, also appear with some regularity in labs. These can vary greatly in appearance, from small, insect bite-like bumps to larger, ulcerated masses. Osteosarcoma, an aggressive bone cancer, typically affects the limbs and is another serious concern. The high incidence of these cancers in the breed is believed to have a strong genetic component, a subject of ongoing research. Early detection through regular veterinary checkups and owner vigilance is crucial. Owners should be familiar with their dog's body, regularly checking for any new lumps, bumps, or unusual changes in behavior, appetite, or energy levels. Prompt veterinary attention for any concerning signs can significantly improve the prognosis for some of these conditions. Musculoskeletal problems are also a major health issue for Labrador retrievers, significantly impacting their quality of life and sometimes leading to euthanasia when pain becomes unmanageable. Hip and elbow dysplasia are the most well-known of these conditions. These are developmental disorders where the joints form abnormally, leading to instability, chronic inflammation, and painful arthritis over time. The genetic predisposition for dysplasia is high in Labradors, which is why reputable breeders screen their breeding stock. While genetics play a key role, environmental factors like rapid growth during puppyhood, excessive weight, and improper exercise can worsen the condition. Another significant issue is cranial cruciate ligament rupture, similar to an ACL tear in humans. This injury causes severe lameness in the hind leg and often requires surgical repair. The active high-energy nature of Labradors can contribute to this type of injury, especially in overweight or poorly conditioned dogs. Degenerative myelopathy is a progressive disease of the spinal cord that causes gradual paralysis of the hind limbs. While less common than dysplasia, it is a devastating, untreatable condition that appears in the breed. Managing these conditions often involves a multifaceted approach, including weight management, controlled exercise, physical therapy, and pain medication to maintain the dog's comfort and mobility for as long as possible. Heart disease is another leading health concern that can shorten a Labrador's life. One of the most significant cardiac conditions seen in the breed is tricuspid valve dysplasia. This is a congenital defect where the tricuspid valve, which controls blood flow between the right atrium and right ventricle of the heart, is malformed. This malformation allows blood to leak backward, forcing the heart to work harder and eventually leading to right-sided congestive heart failure. Symptoms can include a heart murmur detected during a routine vet visit, exercise intolerance, fluid accumulation in the abdomen, and difficulty breathing. The severity can range from mild, with no clinical signs, to severe, leading to premature death. Dilated cardiomyopathy, or DCM, is another heart muscle disease that affects Labradors, although it is less common than in some other large breeds. In DCM, the heart's chambers enlarge and the muscle walls become thin, impairing its ability to pump blood effectively. This can also lead to congestive heart failure. Regular veterinary examinations are vital for early detection of heart murmurs or other signs of cardiac distress. An echocardiogram, or ultrasound of the heart, is the definitive tool for diagnosing these conditions and guiding a treatment plan to manage symptoms and improve quality of life. Gastric dilatation volvulus, commonly known as bloat or GDV, is a life-threatening emergency that can affect any deep-chested breed, including the Labrador Retriever. This condition occurs in two stages. First, the stomach fills with gas, a condition called gastric dilatation. Then, in the more dangerous stage, the gas-filled stomach twists on its axis, which is volvulus. This twisting traps the gas inside and cuts off blood supply to the stomach and other vital organs like the spleen. Without immediate and aggressive veterinary intervention, shock and tissue death occur rapidly, and the condition is fatal, often within hours. The exact cause of GDV is not fully understood, but several risk factors have been identified. These include eating one large meal a day, eating too quickly, vigorous exercise shortly after a meal, and having a nervous or anxious temperament. A family history of bloat also increases a dog's risk. Signs of GDV are sudden and severe. The dog may appear anxious, pace restlessly, have a distended and hard abdomen, attempt to vomit without producing anything, and drool excessively. As the condition progresses, the dog may collapse due to shock. Recognizing these signs and rushing the dog to an emergency veterinary hospital is the only chance for survival. Treatment involves stabilizing the dog, decompressing the stomach, and then performing emergency surgery to untwist the stomach and assess for organ damage. A preventative surgery, called a prophylactic gastropexy, can be performed to tack the stomach to the abdominal wall, preventing the life-threatening twist from occurring. This is often recommended for high-risk dogs, sometimes at the same time as a spay or neuter procedure. Neurological disorders also contribute to mortality in Labrador retrievers. Epilepsy, characterized by recurrent seizures, is one of the more common inherited neurological conditions in the breed. Idiopathic epilepsy, meaning the cause is unknown, typically first appears in dogs between 1 and 5 years of age. While seizures themselves are not usually fatal, they can lead to dangerous situations. A prolonged seizure, known as status epilepticus, is a medical emergency that can cause irreversible brain damage or death. Dogs can also injure themselves during a seizure episode. Management typically involves lifelong anticonvulsant medication to control the frequency and severity of the seizures. Another serious neurological condition, although less frequent, is laryngeal paralysis. This disorder involves the degeneration of the nerves that control the muscles of the larynx, or voice box. As the muscles weaken, the cartilages of the larynx fail to open properly during inhalation, obstructing the airway. Early signs are often subtle, such as a change in the dog's bark or noisy breathing. As it progresses, it causes significant respiratory distress, exercise intolerance, and can lead to collapse and suffocation. Especially in hot weather or during exertion, surgical intervention is often necessary to permanently open the airway and prevent a fatal respiratory crisis. While Labrador retrievers are known for their robust health and joyful disposition, their genetic predispositions and active lifestyle expose them to specific health risks. Understanding these common causes of mortality is not about creating fear, but about empowering owners with knowledge. Awareness of the signs of cancer, musculoskeletal pain, cardiac issues, GDV, and neurological disorders enables early detection and intervention. A strong partnership with a veterinarian for regular checkups, appropriate health screenings, and prompt attention to any changes in a dog's health or behavior is fundamental. Responsible ownership also includes providing a proper diet to maintain a healthy weight, ensuring appropriate levels of exercise, and choosing a puppy from a reputable breeder who performs genetic health testing on their breeding dogs. By taking these proactive steps, owners can help mitigate risks and support their Labradors in living the longest, healthiest, and happiest lives possible.